The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk. Welcome to the Birth Baby Podcast. Each week, you'll find guidance, encouragement, and practical tools to support you through pregnancy, birth, and the postpartum journey. I'm your host, Ciarra Morgan, a certified birth and postpartum doula, hypnobirthing educator, and pediatric sleep consultant. I'm also the owner of a doula agency in Austin, Texas, and the founder of the Birth Baby Academy, where I offer classes for both parents and birth professionals. Thanks for being here. Hello, everyone. Today I am here with Alix Myers. She is a neuro-affirming doula, parenting support specialist, and founder of Tenderly, which is a practice dedicated to supporting families through pregnancy, birth, and postpartum with clarity, compassion, and nervous system awareness. She also helps parents, especially those who are neurodivergent or navigating sensory needs, ADHD and autism, or PDA profiles, create birth and postpartum experiences that truly match how their brains and bodies work, which is why we have her here today. So I want to chat a little bit about pregnancy and neurodivergence. And I've had some families that have gone through this and experienced this. And I just thought it would be so awesome to have you on and share your perspective. So thanks so much for being here.
Thank you for having me. I'm so happy to be here.
Yeah, I think the word neurodivergence for some people means a lot, and they experience that even themselves. And other people are like, but what even does that mean? So can you start by saying what neurodivergent means and what there is like the range of experiences that this term can include?
Yeah. So happy you asked. I love to ground us in the language so we're all speaking the same language. And just to know also, like, this is new lingo, right? So it's very common that we're not 100% sure what it all means. So when I talk about neurodivergence, we're talking about an identity. So that's a really big distinction. This is not a diagnosis. You're not diagnosed as neurodivergent. It's an identity. So there's actually no barriers of entry. If you feel like your brain works differently or moves through the world differently, and you identify as neurodivergence, then guess what? You are. What we're referring to is just the natural diversity of brains, right? So our skin colors don't all look the same, and our noses look different, and our eyeballs are different.
Thank God, right? Because how boring would that be?
Right? So our brains are just wired differently. Now, neurodivergence does traditionally, it does talk about certain types of neuro profiles or brain types. And those include ASD, which is autism spectrum disorder, ADHD, OCD. It's a lot of letters. OCD. And then two that I love to point out because we often forget that this is a specific brain type, but anxiety is considered neurodivergence. And depression is also neurodivergence.
Okay, I didn't know. You taught me something new already.
So think about, and here's a big one, the current stat, and I say the current stat with like the largest grain of salt because research about neurodivergence is like very, very slim. But right now, the research says that in the world's population, 1 in 5 is neurodivergent. 1 in 5.
I think that's low.
So I want you to just think about your family, think about your colleagues, think about your clients, right? 1 in 5. We're not talking about a niche group here. We're talking about a significant portion of the world's population that is considered neurodivergent, which is really surprising for a lot of people. So I think like two big takeaways. It's natural diversity of our brains and not a diagnosis. You do not need a piece of paper to say that you have something specific and that allows you to be considered neurodivergent. If you identify as neurodivergent, welcome to the club.
Yeah. And you did say autism, right? When you were giving all of those.
Autism, yes.
Okay.
Autism spectrum disorder, yes.
Because I think that one's probably when I find that my families that I'm working with are neurodivergent, that would be the one that one parent or the other, sometimes both. That would be how they would identify on that, range. Now, I think that it's also important to point out that not everyone who is neurodivergent feels like this is a thing that is a setback or holds them back. Some people operate very well in this space, and they don't feel like this is something that is like a negative or, a stigmatized thing for them.
So it's important. It's important to know that there is a ton of bias around neurodivergence. And I'm going to put us in the same generation, you and I, but I'm sure you're significantly younger than me. But
I don't think so. I'm 40.
I'm 40. We're the same.
See, we're the same.
Okay,
I would have thought you were younger than me.
Of our generation, we are just learning about our brains now as adults, right? It's very different. And a lot of times we're learning about it through our children. So we've had kids, so the schools start noticing some neurodivergence. We learn about our kids' brains, and then we're like, wait a second, this is totally me too.
That's exactly
and
what
then
happened to
you're
me.
like, okay, well, maybe I am, I do fit on the autism spectrum disorder, and I have ADHD or whatever else it is.
Right.
And so the first thing I would say is a lot of times, even with my clients, they're not necessarily going to tell me. They're not going to say it out loud all the time. Also,
most of my clients don't.
Are we asking? That's another part. I could do an entire thing about birth workers, but are we asking what their neurotype is? Are we creating a space that feels safe enough for them to divulge that information about themselves?
Or at least a question on our intake questionnaire that gives them an opportunity to express it.
Yes. I think the intake conversation is the most important.
Yeah.
But again, that's a totally different podcast. But just to be saying, we are learning about our brains now. We don't necessarily have the confidence. We don't necessarily have the language to describe what our neurodivergence is, what it looks like. And so often we aren't saying anything. We don't accommodate for ourselves. We're just learning. And from my point of view, the neurodivergence, the diversity in the way that our brains are wired is our superpower. It allows us to
You're killing me right now. I did a podcast episode about that. It said when ADHD is your superpower.
Yes.
Because
and it is.
It can be.
Because you think differently. You solve problems differently. You communicate differently. You notice and are empathetic to things in a totally different way. And, I have 3 neurospicy kids. I'm neurodivergent myself. And we talk about it all the time. This is how you are special. And I think we celebrate those differences. We celebrate the things that we need that make us special. It's not I don't think of it as a hindrance.
Right.
I think that every person needs accommodations. I think that neurodivergent people, because of the world we live in, because of the way that society is built, not for our brains, we need more accommodations. But think about all of the great thinkers in the world. They were neurodivergent because they looked at things differently. There's an incredible kids podcast. If any of you out there are new parents and you're like, I can't listen to the baby music anymore. I need to listen to something else. It's called Brains On. It's spectacular, amazing podcast for kids. And they did an episode about ADHD, which was brilliant. And they said, you think about a neurotypical brain. It's like a symphony. It's beautiful. Everything works together. They come in at the right time. An ADHD brain is like jazz. It's beautiful and it's interesting and it's different. And we need both types of music in the world. We can't exist with just symphonies and classical music. We need the jazziness. So I love to describe it that way because it's special in its own way, and it's not worse and it's not better. It's just different.
Yeah. So and we're talking about how it can be this really positive thing, but I think that in terms of birth, pregnancy,
Yes.
birth, postpartum, this can be something that navigating it is a little more difficult. So why do you think it's
Absolutely.
important to talk about this neurodivergence topic in terms of pregnancy, birth, and postpartum?
Well, just like every other big transition, big life experience, we are reliant on the systems that are built for us and are in place. And unfortunately, currently, the world of birth and postpartum and pregnancy specifically are not built for neurodivergent brains. So it means that we as the patient, or we, even if you're going to a birth clinic or seeing a midwife, we have to learn how to ask for the things we need. Because often when we talk about like birth outcomes, we're talking about the success of a birth. And the success of a birth can be, yes, I wanted a pelvic birth and I'm going to have a pelvic birth. But also it's, was I heard? Was I seen?
That part.
Was I asked for consent? Were my needs met? And those pieces of birth and pregnancy and postpartum are just as important as achieving the same outcomes that you wanted, right? Because I have clients, let's talk about two specific clients I've had. One wanted a pelvic birth, had a pelvic birth, came out of it and felt not seen, not heard. The medical team that she used just wasn't responding to what she needed. She didn't feel like she had the language. And I worked with her postpartum, and a lot of it was like sorting through those feelings, because it was like, I had what I wanted, but yet it didn't feel good to me. And then I had a client, wanted a pelvic birth, ended up in a C-section. And if you asked her, she would say she had the most perfect experience. Her medical team was amazing.
The time. Yes.
It's like, yes, we focus so much attention on like the choices that we make, and they're important. But what's really important is making sure that your team knows what you look like when you shut down, when you're in sensory overload, when your executive functioning isn't working. I'm saying a lot of words and I can explain them, but those things are really important too. And as birth workers, it's our responsibility to A, know what all this is, B, ask about it, and C, help advocate for our clients. And when you don't necessarily have a birth worker or a doula with you in the room, how are you going to advocate for yourself? What conversations do you have to have in advance of maybe pregnancy, birth, and postpartum? And how are you preparing your support system to take care of you? Because you need to be cared for. Yeah. So having these conversations is important because, listen, it's so weird. We prepare for everything. You have a job interview, you're going to prepare for it. Your kid is going to a new school, you're going to look into it, you're going to prepare for it. Why, for some reason, do we not prepare for pregnancy? Do we not prepare for birth? Do we not prepare for postpartum? I do not know. But as a neurodivergent person or a person within a neurodivergent family, so that's my clients, the birther isn't necessarily the neurodivergent person. Sometimes it's the partner. A lot of times it's other children in the house. And regardless of who that person is, or oftentimes it's multiple, because neurodivergent brains love other neurodivergent brains. There's a law of attraction there. So if you're in a neurodivergent family, you work differently. You go through the world differently. It just is. You're considering different things. And you need to prepare yourself, your family, to go through this transition. You got to, because you're at a much higher risk for perinatal mental health disorders. You're at a much higher risk for a mental health crisis. And so it's, in my mind, it's a non-negotiable. We need to be preparing. We need to be talking about things. You need to be advocating or find the person that's going to advocate for you.
Yeah, I say a lot of times it's not necessarily how the birth went, and people might not even remember how their birth went, but it's how they felt while it was happening. And so that's 100%. Neurodivergent or not, that's anyone. And I have a lot of times similar to what you say, like if I were to see from my eyes as a birth worker, I'm like, that was a beautiful birth. Oh my gosh, like picture perfect. And then I go to their postpartum follow-up and they are holding trauma from things that happen. And I'm like, oh my gosh, like I had no idea. And then I have times where I'm like, oh, here I go. This is a doozy. let's see how they feel about it.
I
When I go in
know.
and they're so happy and I'm like, oh, winning, like so not going to add trauma where there isn't any. I'll just be quiet over
No,
here. So I think
100%.
this is really important. So what accommodations or support strategies make the biggest difference, for this care and that can even be started prenatally?
100%. So I think when I teach other birth workers about how to be neuro-affirming, how to care for neurodivergent families, I look at three lenses. The first lens is sensory. So when I'm talking about sensory, I'm talking about obviously your five senses. So that's touch and sight and sound and taste, and auditory. And if you can look at the world through these three lenses, specifically through sensory, you can kind of start identifying when people are overwhelmed and what people's sensory needs are. So some people, they really like bright lights because it feels like really structured and it feels like this is something serious is going on here. They like the bright lights. They feel like it needs to be bright. They like, loud noises. They like that sensory input. Some people will literally shut down if the lights are on. Some people cannot stand the beeping in a medical space. So are you considering what your sensory needs are? Have you thought about what kind of touch do I like? What fabrics do I like?
Mm-hmm.
Am I going to hate the pillowcases that are at the hospital? Am I bringing do I have PJs for myself that feel really good because I like loose things for postpartum? Or do I only have things that are going to feel tight and constricting? Are you thinking about, some people really, really like their eyes open to see and to be taking in what's going on. Other people like visual overwhelm is really big. Mess and piles of stuff that's me, super overwhelming. So at every step through pregnancy, through birth, through postpartum, like thinking about what your sensory needs are and preparing for this and accommodating those sensory needs
and letting the people around you know. Please let your doula and your partner and whoever know.
But also, listen, the responsibility is twofold. Yes,
yeah, absolutely.
Please,
but
tell me.
If we're giving space to offer, please tell.
But if I am your doula, it is my job to make you feel safe enough to tell me, to ask the right questions so that it will prompt you to say something. Because you may not know that you have ADHD, right? That's a big one. You may not know, but you will know if you're asked the right question that some sounds really feel awful to you. And then as your doula, I'm going to say, okay, so should we bring noise canceling headphones? Or does that feel uncomfortable? Do we need earplugs? Do we need an eye mask? What about this specific blanket do you like? Okay, so then let's make sure we have that on. There's different ways that your birth worker, I would love to say your doctor and your midwife as well, should be prompting these conversations.
Yeah,
and
that's a tough one, especially with the quantity of people they take.
So that's number one, is sensory.
I love that.
Number two is executive functioning. Now, executive functioning refers to a part of your brain, which I call the CEO of your brain, because it's in charge of organization, planning, execution, follow through, like all the things that we can find really, really hard, especially when we're overwhelmed. And so, okay, my best example is a peanut butter and jelly sandwich. Peanut butter and jelly sandwich, you think I'm going to make one and it's like nothing, I just do it. But actually, making a peanut butter jelly sandwich has so many tiny little steps. You have to get the bread. You have to get the cutting board. Then you have to choose the knife, but not just any knife, the knife you really like to use. And then you put that in the peanut butter, not the crunchy peanut butter, the smooth peanut butter. You take that and you smooth it onto your bread. Do you like the crust? You have to take the crust off. Okay, now, oh no, this knife is done now because I'm going to go into the jelly. So I got to find another knife, an alternative. And then there's so many tiny little decisions that your brain is having to work through to make something as simple as a peanut butter and jelly.
And some people don't even think they don't even notice. And some people, this is really hard.
If you are neurotypical, you're not going to notice those steps. And if you're neurodivergent, you may not notice that your brain is doing all those steps, but you're going to feel the weight of it. It takes up, you have a bucket of capacity. And that's going to take up capacity, right? And if that's taking capacity and you haven't slept, that takes more capacity. And you have to change diapers all day. And you have to, how much capacity do you really have for executive functioning? Often it's not a lot. And if you're a birth worker, are you aware of how much capacity things are taking for your client? Are you aware of executive dysfunction? So I have a lot of doulas that will call me and they'll say like, I have this client, we clicked. We have such a great fit, such a great relationship, but like they're not calling me back. And I'm trying to move forward and they're not calling me back. And my brain goes, what is going on in their life? Do they have the capacity to call you back? Maybe texting is easier. How do we accommodate their capacity for executive functioning? And how are we cluing into that? And if you are the client, so we're just learning to kind of say, hold on, I am just done. I don't have the capacity. I cannot continue. And making a peanut butter jelly sandwich for me today is too much. We're just learning to say that. That's really, really hard. That's like advanced level neurodivergence, is being able to say, I'm in executive dysfunction right now. So that's lens 2. And lens 3 is communication and communication styles. So I'm like a verbal processing person. I can talk your ear off, and that's how I process the world. I have clients who just want to text. They never want to have a conversation on the phone. They definitely don't want to be on Zoom. I have clients that prefer me to be there in person. Some don't. I have clients who, in an intense situation like birth, rise to the occasion. They're able to advocate for themselves. They are really clear. And I have a lot of clients that in an intense situation or when they're in pain, they absolutely go inward and are silent.
And that might look to the outside like they're tolerating things very well, but it actually can be shut down.
You're at births, right? You know, when you're advising your client to go to the hospital, let's say, and they're going to the hospital and they're loud. A nurse immediately is looking for how loud your client is to decide where are they? Really, are they transitioning?
Should they really be here? Yeah.
Should they really be here? Am I going to send them back? Yeah. But what if they're quiet? Then nobody's going to notice where they're at. I know so many stories of neurodivergent patients who go in and they're quiet and they're jazzing and they're talking and they're making jokes because that's how they handle intensity. And their doctors and nurses don't understand what's going on. And they say, I'm feeling pressure. And the nurse is like, wait a second, you're crowning. Because that is how their brain manages intensity and pain. So as a birth worker, are you asking those questions? Are you, as the patient, saying to your doctor, your nurse, when you walk in, when I go quiet, know that something's up. I'm not going to be able to tell you. How are we telling our partners? Partners are so important. I don't mean
more important than anything.
Sometimes romantic partner. Whoever it is. Sometimes romantic partners are great. Sometimes they're not. And you need to bring in someone that can advocate for you, right? Are they going to recognize that you go quiet, something's up, right? Who's going to be that person that's identifying it if you can't advocate for yourself? So it's all sorts of stuff like that. And the tools I use in those situations are, we have like nonverbal cards. So like you can put it down when you say, I need you to explain that again. So you don't have to say it. You just put it down and the person knows. We have scripts that we practice. I need 5 more minutes. Can I talk to my doula about this? My partner and I need some more time. Like those types of things are scripts that we practice. My favorite thing is to have a nonverbal cue. So it's like rubbing your chest or pulling on your ear or whatever it is. And that tells me as your doula or your partner or your nurse, if you've even had that conversation with them, or your midwife, to say something's not right, or I need more time, or there's too many people in the room, whatever your cue is supposed to refer to. And sometimes that's all we can handle and all we can do. But you need to know that about yourself. You need to be asked the right questions and you need to prepare in advance.
Yeah. And again, that communication can be really difficult depending on your ability to communicate and how safe you feel with the people around you to do that. So you did mention sensory and some of the things, like you talked about pillowcases and pajamas and noises and things like that. So hospital settings can be really overstimulating. So are there, and honestly, I always tell people, no matter what birth location you're in, there's going to be. So I don't want you to think, if you're listening to this and you are neurodivergent, that like home birth is automatically like the answer for you, or birthing center is. If it is, great. But I don't want you to think that that's just going to solve all your problems, because there's the Amazon delivery that comes. There's the dog is barking, the trash truck came, like, and everywhere you go. Other kids
in the house.
Birthing center, you can still hear other people, a motorcycle whizzes by. But they're going to have to take your blood pressure and, every however long, and your temperature and things like that. There are always going to be distractions and noises. Yeah. So you're going to need to think about all of those different scenarios. So are there things that that are tangible that people can think of when trying to reduce overstimulation before they're going in? Some things that they could have in their toolbox?
Of course. So I mentioned noise canceling headphones. Those are fantastic. But you also can ask for noises to be turned off. You don't have to have the monitors on loud. It's something you can ask, and you should know that. What are you allowed to ask to turn off or insist? Some people don't
insist. I like that word. Can we say that for a second? Even when you said, can I have more time? We don't always have to ask for what we need. We can just tell. You don't have to be so nice. If you feel like you're just not going to be listened to, just give a statement. It doesn't always have to be a question.
100%. I will just say that a lot of neurodivergent people, we have a lot of medical trauma. Yeah. And so what happens is we go into people-pleasing mode. We want to be the best patient. So we often try to be overly polite. And that, to me, as a neuro-affirming doula, as somebody that knows this, would be a sign to me something's going on. They're becoming too performative. So yes, know that about yourself too. I know when I go into a doctor's office, I have to walk out and they have to be my best friend. I don't know why I do that, but it's something that comes over me. But when I'm overperforming, that needs to be a signal to whoever's
the other people in your life. Yes.
Yes, that is a signal that I'm overwhelmed, that I'm overstimulated, right? Because I'm overcompensating. So 100% you can insist. You don't have to ask. You don't have to be the best patient. You don't have to be overly polite. They're there to help you and do their job. Now, sometimes you're going to win them over with kindness, and sometimes that's a strategy too. But
true.
Highly recommend having a birth worker with you, because they're going to be able to negotiate that relationship and you won't have to.
Sorry, I didn't mean to interrupt you, but I just wanted to make sure people hear that. You don't have to ask if you feel like you're not being listened to.
No.
Even if, it's hard, but if you can stand up for yourself.
Yes, absolutely.
Or the people around you can.
Okay, so tools. So noise canceling headphones, sometimes they can feel like a lot because they're big and they're tight. So AirPods, I wear AirPods all the time because they have that noise canceling, but yet they fit in your ears. Some people don't like that. You could go to the pharmacy and get those squishy, old school earplugs, throw those in your bag. Have a variety of options. You're going to be there for a while. Mm-hmm. It's nice to switch it up. Eye masks I love. I also am really big into those LED candles. So I have a big box of them. I bring them. I turn the lights off immediately. Candles everywhere. This is your birth space. Make it feel like what you want to feel like. And if you want it to be this cozy, intimate space, make it feel like that. If you like having the lights on, turn those lights on. But you get to choose. This is your space and your environment. And this is something you should be planning in your birth planning sessions or whenever you're having those conversations. The other thing is scent. So scent can be really big for people. When you're in a hospital or a birthing center, it can be a little antiseptic in terms of the aroma. So if you like a diffuser, bring a diffuser. If you have a hand cream that makes you feel just calm, bring that. I really highly recommend thinking about the things that you use in your everyday life that calm you. A lot of people like those peppermint rollers. Bring a peppermint roller wherever you're giving birth.
I call it creature comfort. Anything that's a creature comfort for you. If there's a blanket you cozy up with at home a lot, bring that blanket so that you can cozy 100%. Up with that.
Absolutely. We talk about those those things that you have to have in your birth bag. But like, we're forgetting all of those comfort creature things. You know, if you like a weighted blanket, bring your weighted blanket. I know it's a pain to like schlep everything, but just bring it. You're going to be happy that you have it. I'm such a big fan of like walking in there with huge suitcases. Like, I bring everything.
I have a rolling bag as the doula.
I don't understand those doulas that walk in with a knapsack. Like, I got everything.
Same.
So think about those things. Think about the things. I always say, like, bring a pillow, like your pillow. I like a strong pillow. Like, I don't like a soft pillow. Bring the pillow that you like. Put it in a patterned pillowcase. This is my best advice.
Yes, no white pillowcases.
Hospitals never have a pattern. I've been to hospitals where they have a blue pillowcase, and I'm like, okay, it's got to be a pattern. But bring a polka dot pillowcase so that you don't mix up your pillow with
it's yours. Yeah,
they know it's yours. But bring your pillow so that you're comfortable. Don't leave those things at home. If you like music, bring your own speaker. I think like those things are really, really important, and we should be preparing our clients and as parents to bring the things in birth that make you feel comfortable. I also just want to note that when I'm talking about sensory, that's not specific to birth. So sensory is really important in pregnancy too. We talk about, like, a really good example is talking about the baby moving. Everyone's always so excited. Is the baby move? Did you feel the baby move? And they're so excited. For a neurodivergent person, the baby moving can be awful. It's a complete loss of control over your body. It's happening all day long. It can feel awful. And so understanding that your sensory system and that is heightened, you have your hormones are like way up high, everything's heightened, and then you have something inside of your body that is not within your control. And that can be really overwhelming. Things like in postpartum, oh my God, letdown.
That's what I was going to ask you about next. Yeah, what are some of the things in postpartum?
Let's talk about letdown. Now, letdown is a range, right? Everybody feels it differently. But if you're neurodivergent, it can be excruciating pain. Excruciating. And everyone's walking around being like, it's not so bad. And your lactation consultant be like, it's fine. You know, it's not. It's pain. And we as neurodivergent people and neurodivergent brains feel pain differently. We process pain differently. Our neurons work differently. So it's really important to understand that even though the narrative outside of your household is that things feel good or it's different, what's happening to you, your experience is valid and it's true. And I believe you. And
whatever
as
birth it is,
workers, please believe them and validate their experience. And if letdown is excruciating, I'm going to say something super controversial. If letdown is excruciating and it's happening to you 10 times a day and you can't take it anymore, like, let's talk about what your feeding plan is. Let's talk about what's realistic to you. Because it's not realistic to be in excruciating pain all day.
And it might not be painful for you, and great. But if it is,
great.
You know, it's okay to switch plans. And also, not only just pain, some people get like a gross out factor. Like, I had a nausea like wave that would happen, and I could more tolerate it when I was nursing directly. But a pump, I mean, I can feel it right now in my throat. This little like weird gag sensation.
Yes.
Just thinking about pumping, and
even
it's
the
weird,
sound of pumping, right?
Yeah. Yeah.
The sound of pumping, it would drive me nuts.
I feel like I can't even take a full breath just talking about it.
It's that noise. It's that noise. And it was so confusing to me because it was the only 10 minutes a day or 20 minutes a day that I couldn't hold a baby. I couldn't take care of anyone. Right. So like on one hand, I was like, oh, this is my alone
thought you'd
time.
Love it.
And on the other time, it was like the feeling of the pull and then the noise was making me insane. So I think like, it's really, really important to realize that everybody's experience is different. Your body's going to react differently. And to know that it's real. This is really happening.
Yeah. I think that that's really important because I would say, usually I say that people like to say their negative experiences because, you know, when we say positive experiences, it seems like bragging. I feel like that in terms of how your birth outcome is, I feel like a lot of times people are worried to share their positive experiences. But in terms of how you experience pregnancy, I feel like it's the opposite. I feel like people are more worried about sharing their negative experiences as though it will seem like they're not thankful that they're having a baby, if, or that they're not appreciative or they're not loving their child enough or whatever. But like, not everybody loves being pregnant, neurodivergent or not. And if you're neurodivergent, there might be like this extra heightened effect for things that you didn't even anticipate, and that can be blindsiding. And so it's important to know that these are there. You may not experience all of these things that we're talking about, but just knowing that it's a possibility so that you don't feel abnormal when, that is your normal and that's okay.
Yes. Yeah. 100%.
So what are some ways? Oh, go ahead, please.
I was just going to say, because you mentioned attachment, and it is really, really hard. We talk about attachment as though it's this like natural, immediate thing. And for a lot of people, it's not. Mm-hmm. And especially for neurodivergent folks, it really can take a lot more time. So just be really kind to yourself. Be really kind to yourself throughout this whole experience. It's hard. This is not an easy transition. And like, just know that there are people out there that can support you, and just be really kind to yourself, I would say.
Yeah. Are there any other things that you think that people should be considering going into that postpartum phase? What are some of those other things? So we talked about, breastfeeding or chest feeding, let down, all of these things. What about some other things? Baby crying? That can be a big one.
Absolutely. I would say in terms of like the sensory piece, the postpartum period can be almost the most challenging. Mm-hmm. You're going from so you may have other kids, but it's the lack of your basic needs aren't necessarily being met. So your capacity is way less. So things like noise that may not have bothered you outside of this perinatal period may just absolutely make you want to scratch your skin off, right? The noise of the baby, the demand
of the swing, even. I remember that drove me nuts.
Yes.
I loved the swing, and I was like, I can't hear that thing tick one more time.
The feeling of having the baby on your body at all times, even like skin to skin. We know skin to skin is spectacular for the baby. It's spectacular also for the parents. But the feeling of another body on you can be agonizing. It can be hot. It can be uncomfortable. So I think like the postpartum period is so intense in so many different ways. I also just want to call attention to executive functioning in postpartum is often an absolute mess, right? There's so many demands on you. You have to recover. You're recovering, right? Even if you're not a birthing parent, you are recovering from this massive change and transition. And if you are the birthing parent, you're recovering from a massive ordeal that your body went through and a hormonal shift like no other.
It's just like that on steroids. Yeah.
It's like, yes. And so you're recovering. You have a wound, whether that wound is outside your body or inside your body, and right? Like you can have 1 to 2 to 3 wounds. You are in recovery. So you have to take care of yourself, which is hard. And then you also have to take care of this other little person that is not able to care for themselves at all. And then you might have to go back to work, especially if you're in the US. How much time do you really have to recover and take care of this person? You have a partner who might also be struggling. You have parents, you have other children potentially. There is a lot on your plate, and your CEO of your brain is often overwhelmed and incapable of doing the things that normally came easy to you. Mm-hmm. And then there's the things that never came easy to you and are absolutely impossible. So are you able to take care of yourself? Are you able to put in a load of laundry that might just be too much and overwhelming? And so when we talk about the postpartum period, I find that the more that you can do in advance, the better off you are. So one of the things I do with my clients when we're planning for postpartum, that's another thing, is like we plan for postpartum. We plan for birth. We plan for postpartum.
We need to. I feel like I'm a birth doula, childbirth educator, but I'm like, y'all are putting in a lot of time for these couple of days that you're going to be, but like, what about all the other days after that? What are you doing to plan for that part?
So with my birth clients, we do 2 hours birth planning and then 2 hours postpartum planning. And I want to say that the postpartum planning is the most impactful. It's having those conversations with your partner about like, how are we going to balance things? Who do we need to bring in to help us? Whether that's family members, are we realistic about what our family members are able to deliver and commit to? Mm-hmm. Do we need to hire someone? Do we have the budget to hire someone? Like, we really need to talk about the things, because I can guarantee you, you're not going to want to make yourself soup. You're just not. It's not happening. You're not making a soup.
It's really sweet of you to think that you're going to want to.
Yes.
We understand. We understand the thought.
I don't care how much you like to cook. You're not making yourself soup when you've just had a C-section. Yeah. And your partner can't do everything for you. And are they going back to work? And like, you have to negotiate these things in advance. Mm-hmm. We always have a sign that I put on the fridge, and it has all the different things that this family likes to eat. What is your coffee order? What do you like from this takeout place? What do you like from that takeout place? Because when you have visitors, I don't want you to have to say, like, they're going to be like, what can we do for you? And it's like, I may not have the communication skills at that point to communicate that. I might not have the brain power to think of what my coffee order is or ask for help. So that's on your fridge. And they walk in and they see it and they can Uber Eats you whatever you've already said you like. And
I tell people to make that list. I tell them to put on like 3 to 4 minute tasks, because it's so hard for us to ask for help. Even if you have the ability and you can actually think of the thing, the vulnerability that it takes to say, when somebody says, oh, is there anything I can do, for you to be like, yeah, would you wipe down the kitchen counters? Like, you're not going to do that. So I'm like, you know what? Fine. Put it on there and say, you know what? We're totally fine. If that's what you want to say, we're totally fine. But my doula did make me make this list over here of items that if you want to pick something off of there, any of those would be helpful. I say that all the time. I'm like, blame it on
me. So we put that on the door. I have on the door the rules of the game, right? We are so happy to welcome you. We can't wait for you to meet the baby. Please wash your hands, because sometimes it's awkward to say wash your hands. Take your shoes off. And here are a couple of things that you can do to help us. Throw in a load of laundry, wipe down the counter, whatever it is. It's too hard to talk and say these things when you haven't had sleep, when you haven't been eating normally, when you haven't drank your water, you know.
And sometimes it's hard even on the best day.
It's so hard. And like, what is your partner's role postpartum? Are they the boundary bouncer? Are they the ones that are saying like, no, mom, you can't come over today? Are they the ones communicating for you? The baby is doing great today. Here's some pictures. Who's doing all this stuff? We need to talk about it in advance, because if you're expecting that you can process and negotiate, and you can't do that once you've had a baby, when you're in that like deep tunnel of times, you just don't have the capacity. So preparing for that executive dysfunction, to me, is the greatest gift you can give yourself. And like, I have a client right now who's saying, oh, I'm going to hire a nanny that's going to help me, because I know when my husband goes back to work, I'm going to need some help. My mom's going away and I'm going to need some help. And I was like, that's great, but don't leave it until then to hire the nanny. We're going to do that now. Let's do some interviews and let's have them come, and your older child will meet them, and let's get them into the routine of the house, so that when that time comes, when your partner goes back to work, when your mom goes away and you're alone, are you going to train someone to help you? No, you're not going to be able to say what you need.
That person needs
to be able to
still have to be able to communicate with them about what needs to be done.
Let's do some kindness for our future selves and do that now, so that when that baby's here and you're overwhelmed, that support person can come, jump in, and knows what to do.
Yeah, I love that. Well, you answered so many of my questions without me even having to ask you. I love it. Okay. Is there anything else that we missed that you want to share?
Well, I just want to share that I'm actually launching a birth planning course. It's all online. It's pre-recorded. You do it in your own way, in your own time. And it goes through all of this: your sensory system, your executive functioning, your communication skills. And it's at the end of this course, you come out with a birth plan that you hand to your doula, you hand to your midwife, you hand to your doctor. And like, it's all done for you. And I highly recommend, whether you're neurodivergent or not, if you're a birth worker, send them to me because honestly, it just does the job for you and they can do it in their own way. And it's built for neurodivergent brains, which is awesome.
That's amazing. Good for you.
Yeah.
What a big accomplishment.
Oh, it's like my little baby. I'm so excited.
I have that. I have a birth class now that I have like a self-paced birth class and people can buy it on their own and do it in their own time because not everybody can show up in person and that's okay. But when people buy it, I'm like, oh my gosh, look, somebody bought that. Like, that's my baby. I hope they love it.
I know. It's so exciting. And the other thing I would love to say, because I know there's birth workers that listen to you, I do every month a free webinar all about providing neuro-affirming care to your clients. I'll teach you all this stuff about lenses. And so that, because, like my job is a doula but this part of my work, it feels so important. It feels like advocacy. And the more neurodivergent families and all families that are getting this type of support, the better off we all are. And we're going to change the systems to be more accommodating. So feel free to add me on Instagram. It's lovetender.ly_doula. And this free webinar, I would just love to have you all there.
Awesome. Thank you so much. And I'll put those things in the show notes as well. Thank you for being here.
Oh, it was a pleasure.
Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.